Good afternoon and welcome to Stock Talk. My name is Pam Iwanchesko and I will be your host. Manitoba Agriculture is offering a series of livestock and forage webinars to help Manitoba beef producers. These webinars will run monthly until April. We are glad you can join us for today's presentations. A few timely reminders that MASC has a variety of insurance programs to cover off special crops and coverage situations. This includes the select and basic hay insurance, as well as other forage insurance options. And the deadline to apply is March 31st, so contact your MASC office. They also have the livestock price insurance. And if you want more information, you can contact your local MASC office, or our last month's webinar featured information with regards to the livestock price insurance program. So check out the Manitoba Agriculture YouTube channel for that webinar. The MASC offices also cover off wildlife damage compensation. It has two components that you don't need to have an MASC contract to be eligible. The program compensates producers who suffer losses due to attacks from predators as well. And just a timely reminder that the Manitoba precipitation map is showing that large parts of the province are drier and below 100% normal precipitation. So it might be a good time to look into insurance options if you are in one of these areas. And one of the other programs I wanted to highlight was the Verified Beef Plus program through MBP. If you have any questions with regards to that program, you would want to contact the Manitoba Beef Producers Office. A lot of eligible items if you qualify for verified beef production once you go through their certification process, and there are quite a few different programs that you could get software programming that will help keep track of records on your operations. So without further ado, I'd like to turn your attention to today's agenda. First off, we have Dr. Cindy Jack, from the Morden Vet Clinic, and she's going to be talking about calving tips and dystocia. So Shania, you have the podium.
Perfect. Can everybody see my screen? Good. Okay, perfect. So I'm Dr. Shania Jack. I work out of the Morden Vet Clinic. So I'm just going to go through some calving malpresentations that we typically see, some tips and tricks, and when to call the vet, kind of a thing. So thank you guys for having me on today, and we will get started. So the first steps to dystocia is figuring out why the calf isn't coming out the back. So there's 3 P's to calving: presentation, position, and posture. Presentation refers to whether it's coming head first or is it coming butt first. Position is the calf's position in relationship to the cow. So is it upright? Is it upside down? Is it sideways? And posture refers to its limbs and the head. So is it a head back? Is it a foot back? What's going on? So knowing when to intervene is really, really key. Other things that can cause issues with calves is size. So fetal monsters, a really small mum, small pelvic size, deformities such as the one that's in the picture here. So that was conjoined twins. One of my colleagues was wondering why he couldn't get the twisted twins apart, and that was the reason, was that they were conjoined. And then of course malpresentations. So there's 3 stages of labor. The first stage is cervical dilation and nesting. So the cow's going to be restless. They separate from the herd, might try and steal another cow's calf. The second stage is when the calf is born. And then the third stage is when we have the fetal membranes or the placenta expelled. So intervention is needed when there's signs of stage 1 has been going on for longer than 6 hours. So she's been restless for 6 hours, tail up, that sort of a thing. And she hasn't started pushing yet. Or if you see continuous cycling, so the cow is up, down, spinning around a bunch, just looks really uncomfortable, then we should check her out if that's been going on for a while. Heifers, we want to see that calf delivered within 90 minutes of the water bag, and cows 60 minutes of the water bag. Or if you see them straining for 30 to 40 minutes and after a foot's shown in, they've made no progress. So the Beef Research Council has really good information on this sort of stuff. Sorry, our clinic cat is bugging me. A big thing is, can this calf come out the back, or are we going to need to do a C-section? Does it need to come out the emergency exit? So a good rule of thumb is if we can pull both of the calf's fetlocks a hand's length, or about 4 inches, outside of the vulva, and the calf's head is completely within the birth canal, the calf should be able to be pulled. So oftentimes what you'll feel when you get those chains on and you're pulling, you can kind of feel a pop when those shoulders come into the birth canal, and if the head is there, it should be able to be pulled. When the shoulders of a large calf enter the birth canal, the pressure on the legs often causes them to cross if it's too tight in there. And if you see that, like the front legs are sticking out of the cow and they're completely crossed, usually that means that she's going to need a C-section because the calf is too large. If you do a vaginal exam, you reach in, you should be able to feel all the way around the calf, between the cow's pelvis and the calf, with your hand. If you're wedged in there and it can't move, typically that requires a C-section as well. For our backwards calves, being able to get the calf's hocks out, or the calf's hocks sticking out, would indicate that the calf's hips are in the pelvic canal, and the rest of the calf should likely follow, as that typically is our widest point. Something I really want to touch on, because I've seen a couple of these this year, is always double looping your chains, okay? So the first loop goes above the fetlock and the second goes just above the hoof. And we do this to distribute pressure. We've seen some broken legs from just a single loop on our chains, even if you're just hand pulling. And these are really bad breaks because they damage the blood supply as well as some of the nerve supply. And oftentimes we can maybe heal the break, but they'll slough that limb because of the blood supply damage. So the first dystocia I'm going to talk about, or malpresentation I'm going to talk about, is a foot back. So this almost always causes dystocia. Sometimes really small calves can be naturally quite rare. So to correct this, you want to gently push the calf back into the uterus to allow more room. Trying to work in that narrow pelvic canal is quite difficult. You're going to grasp the limb near the elbow, pull it up and push back. And then once it's in the flex position, like the second picture shows there, you want to cup the foot in the palm of your hand. And that's really important to protect our uterine wall, cupping that foot, because they can be sharp. And then pull that foot upwards, a little bit inwards toward the calf, and then straight back towards yourself. Calves, when they have both feet back, can sometimes present with their head sticking out of the vulva. And that the principle is the exact same way to correct it, but it can be a little bit trickier, because when the head is sticking out there, there's lots of pressure and they often get emphysematous really quickly. And so they can get stuck in that position. Head back is the second one we'll talk about. The best way to correct this is by grabbing the muzzle. You can also grab the corner of the mouth or the eye socket, especially if the calf isn't alive anymore. Grabbing the eye socket sometimes is a little bit easier. You want to try to have your hand covering those little sharp incisor teeth, because again, it can cause some damage to the uterus. You may need to push the calf back into the uterus in order to reach the muzzle. Sometimes you feel in there and you can't feel anything with that head back. So yeah, pushing them back a little bit sometimes allows that muzzle to come up just a little bit. So you want to gently lift on the muzzle while turning the head into the correct position. I know there's head snares out there. The purpose of a head snare is to pull the head into the pelvis after it's been repositioned manually. You don't want to hook onto that to pull it around, because that can be quite damaging and you can actually break jaws that way. One reason we see head backs in calves is because they're too big. So they're trying to get into that birth canal and there's just no room. So it pushes that nose back. So oftentimes we'll see really big calves with head back. So backwards calves, a normal backwards presentation, both hind legs will be there and the tail will be down and between the legs. And you want to make sure of that when you're delivering them, because sometimes that tail can stick up and can cause a lot of damage that way. You can recognize that it's a backwards calf because you can see the sole of the calf's feet facing upwards. And to confirm that it's actually a backwards calf and not just an upside down forwards facing calf, you can see which direction the joints bend in relation to one another. So the fetlock and the knee of the front leg are going to bend in the same direction, whereas the fetlock and the hock of a back leg are going to bend in the opposite direction. The largest part of the calf is coming first when they're backwards, so that's why they often need a little bit of help to deliver these calves, and oftentimes they can be a bit bigger because they haven't rotated around into the correct position. You may need to rotate the calf a little bit in the birth canal to help them be delivered. I tell guys to try and spend a little bit of time, like it's a little bit more of a rush with our backwards calves because of where that umbilical cord is and their head's not outside of the birth canal. So it's a little bit, you need to move a little bit quicker, but you do want to spend a little bit of time trying to dilate just so that it's easier to deliver that calf, because there's not that normal pressure there. So they often don't dilate properly with these guys. So yeah, like I said, big thing to consider is the umbilical cord will be constricted or be torn before the cat's head is exteriorized to allow breathing. So you need to move rather quickly if you're going to pull a backwards calf. So breech, that's when both legs, it's just bum coming, both legs are down. It's very common in cattle, and oftentimes they won't show signs of stage 2 labor. So that's why we need to check them if they've been going on in stage 1 for a while or have been quite restless for a while. There's no forceful straining as there's not enough stimulation on the cervix for this. So with this one, they're pretty tricky. You need to push the buttocks upwards and back while pulling onto the hock. And you're trying to get that hock into a flexed position. It's helpful to place a chain at the level of the hock sometime and have somebody, if you have a partner or something that can help you, just put a little bit of traction on this so you're able to get the foot into your hand and pull it inwards, upwards, and back a little bit towards the calf while pushing the hock forwards and towards the pelvic wall with the other hand. So it's a little bit tricky and it takes some time. And again, you want to try and protect that uterus with your hand over the foot as much as possible. These guys can be quite hard and often need some vet assistance to get corrected or potentially need a C-section. Hip lock or stifle lock. If you're pulling a calf and it gets stuck at the hips or the stifles, you want to stop pulling and give it a chance to breathe. And so the head is out of the birth canal. We don't want to just yank them out as quickly as possible. We can see lots of damage to this. We've seen broken legs, potentially even a broken pelvis for the mom. So you can stimulate it to breathe a little bit and then kind of reposition and keep pulling. So if it's hip locked, the head of the femur is catching on the pelvic brim. So you want to try and rotate that calf 45 to 90 degrees to take advantage of the greater vertical diameter of the pelvis. To do this, you're going to cross the front legs and then pull. In a stifle lock calf, it's the stifle's catching on the brim of the pelvis. With this one, the calf will be 3/4 of the way out, but stuck at the hips. So instead of pulling straight out, you want to move to pulling downwards. And this allows the calf's rump to rotate up into the cow's pelvis, and the stifles will enter the cow's pelvis more easily. So the forward-facing upside-down calf, often mistaken for a backwards calf. These guys need to be corrected as they can severely injure the calf to deliver it this way. So just with how the spine is and how the pelvis is, if we try pulling them this way, we can cause some pretty serious spinal damage. The pelvis's arch can create a lot of issues there. So place the chains on the feet and you want to push the calf back into the canal so that you have a little bit more space to work. cross the legs over each other, and then pull down on one leg, and they'll rotate. You can use your opposite arm to help kind of scoop the calf over. It's a lot easier if the cow is straining or if the calf is alive. Dead calves that are upside down are quite difficult to deliver, get rotated back, and you still want to do it because you don't want to cause damage to mom. I know if baby's dead, you don't worry about spinal damage, but you still want to be careful for mom. So yeah, the transverse or dog sitting calf. So when you see this, all 4 feet will be there, or you reach in and it's just the back. You can try and push these guys in and get a set of feet into the canal, but this typically results in puncturing the uterus because you don't have control over that other set of feet. So these guys usually require a C-section or a phytotomy. So typically it's something you need to call your vet for. So uterine torsion, it happens because the uterus is unstable and rotates very easily, especially in those last trimester of pregnancy. The calf is moving and the uterus is just so unstable. We see this flip. So it's an emergency. It typically requires a C-section, or sometimes vets may be able to get a detorsion rod on the feet and be able to flip it that way. But you need to call the vet for this. Sometimes we see cows will really start pushing with these and there's just no progression, and they can pop a calf's foot through the uterus because they're pushing so long, and that's a big emergency, and they can die quite quickly from that. So to diagnose a uterine torsion, you want to reach in you can reach into the vaginal canal, and oftentimes you won't be able to get through the cervix. You won't know what you're feeling. It just feels a little bit off. It feels like can't get anywhere. You know, she's calving, but doesn't feel like she's opened up. But if you go in rectally, you'll feel a tight band either going to the left or to the right. And that's just from the band of the uterus. So it's either going to be clockwise or counterclockwise rotation. And sometimes they can be 180 degrees, like what's shown in this picture, and other times they could be a complete 360 degrees, and that's when you can't feel anything when you go in there. So this is a developmental abnormality that it can occur in calves. It's a water belly calf. So it's kind of no wonder this didn't come out the back. It's that huge amount of fluid in the abdomen, and it can't pass through the birth canal this way. So sometimes these guys can be removed via phytotomy. Other times we need to do a C-section for them. This is an emphysematous calf. So this calf had died and wasn't delivered, so it swells up due to bacteria. So I just include this picture in there because oftentimes we will actually euthanize these cows rather than doing a C-section or trying to do a phytotomy, and that's because there's a huge risk of contamination. You can see how big that calf is compared to that cow. Trying to get out the side is extremely difficult. And a phytotomy is difficult to do too sometimes because you can't feed your wire around the calf. So yeah, this is often a panic for guys when they see this, like what's going on here. So it's called a schistosomus reflexus. So that's an inside out calf. So little guts, not a big worry. It's the calf. So it's usually a schistosomus. When you see the bigger intestines, that's when we really start to panic, because oftentimes that means there's a uterine tear somewhere and the cow's intestines have come out. But these guys are a veterinary emergency. They require a C-section or a phytotomy to remove them. They're not coming out the back like that. So, like I said, the Beef Research Council has some great resources out there. So this is a calving decision tree. So it kind of lets you know when we need to call the vet. When assisting cows in delivery, the object is not to pull the calf out as fast as humanly possible when they're forward facing. It's actually important to allow the calf and the cow to rest. You should be pulling when the cow is pushing, and then relaxing when she relaxes. Both the cow and the calf need to rest a bit. The cow needs some time for her muscles to relax and to catch her breath because birth is very strenuous. And the calf actually needs to breathe once their chest is outside the birth canal. So their hips are still inside at this point. The umbilical cord is pinched off by the pelvis and can no longer provide oxygen from the circulating blood. And so they need to be able to breathe in order to get that oxygen, and constant pulling can actually make it so the calf can't expand its chest properly. So if we don't provide breaks for the cow or for the calf to breathe, they can often die from asphyxiation. So guys will pull, the calf comes out quick, and then all of a sudden it's not lively and it dies. They can't stimulate it to breathe, and that's because of the asphyxiation from the chest being compressed. So just some final tips. Painful cows aren't good mothers. If you have your hands in a cow, give her some sort of pain medication, whether that's Medicam, Rumicam, whatever you have on hand. The calves, we want to give them some anti-inflammatory too, especially if their face is swollen, because we want to get that colostrum into them as soon as possible. So we need a dose of colostrum into those calves for sure by the 6-hour point. We prefer to get it in within the first 2 hours, but after 6 hours, our guts start to close, so they're not able to absorb all that good stuff from the colostrum. Take a moment. It's really easy to get worked up. I understand that. It's your guys' livelihood, and you know, calves are worth a lot, and so are cull cows. But if it's not coming, don't just use more force. I've seen guys break jacks trying to get a calf out. They break cows' pelvises, damage calves, that sort of stuff. So just take a moment, breathe, try and see what's going on, and call your vet if you need assistance. Take time to dilate. Like I said, you want to put your hands in that birth canal and push apart. That's how we help dilate. Always check for tears and tears. So reach in, make sure we didn't accidentally damage the uterus. See if she's got a second calf in there. They're often exhausted after a big calf, and if they do have a second one in there, they probably are going to need some help to get that one out. Colostrum, like I said, is extremely important. You can keep frozen colostrum in the freezer for about a year, and then we start losing some of our good properties to that. Stimulate our calves to breathe, either using straw up the nose, or you can use a small gauge needle. There's an acupuncture spot in the tip of the nose. When you poke it or press it, it stimulates the central nervous system, which increases their heart rate and rest rate and overall consciousness. So you take the small gauge needle, poke it in the center of the nose, usually about a 20 gauge needle, twist it a little, and that helps stimulate them to breathe. You can also press that spot with your finger and your fingernail if you don't have a needle on hand. Straw up the nose also helps to stimulate calves to breathe. Get them in the recovery position, which is what the picture I'm showing here on the slide. So that allows them to be able to breathe the easiest and expand that chest. Rule of 15. So that's the 15-minute rule. If you've been working at a calving for 15 minutes and you've made no progress at all, we need to change our game plan. Do something else, call the vet, call a friend, maybe see, you need something, a partner to help you reposition those legs or something like that. And then one final thing I wanted to just mention, I learned something new this year. We've been having some issues sometimes with cows accepting calves, and something that you can try is intranasal oxytocin. So that's the feel-good hormone. You just squirt it straight up the nose. It goes directly to the brain, and they seem to accept their calves a little bit easier that way. So if you're having a cow that's not accepting her calf, or you're having a hard time grafting a calf on a cow, that is always an option. So that's the end of my presentation.
Great, thank you very much, Shania. Any questions? I've got one, Shania, just with regards to the difference between heifers and mature cows. Sure. Would you treat them differently with regards to, a heifer's first time calving? Is there things that you would look for differently versus a mature cow if they are having some dystocia issues?
Sure. So, like, you can give a heifer a bit more time, because they don't know what they're doing, right? It's everything's new to them, that sort of a thing. So typically we allow them a little bit more time. Like I said, 90 minutes versus 60, so that extra half hour to try and get that calf out. Otherwise, like most producers are using smaller calving bulls, so we don't necessarily see more dystocias in our heifers if we're using an easy calving bull and checking out our heifers and making sure that they have wide enough pelvic canals to be able to deliver their calves.
Okay, great. Are there any other questions, Erin?
No, I don't see any. If anybody has any questions, you can type them into the Q&A at the bottom toolbar of the Zoom screen, but there's none currently in there.
Pam, I have a question for Shania. So
Sure.
a lot of really good tips, Shania, that you provided to producers. So in a producer's calving toolbox, what are some of the must-haves that they should have in there, and make sure that they have it in there before the first calf arrives so that they're prepared in case that it's required?
Sure, yeah. So Medicam is a big one. Powdered colostrum, I like having a little bit on hand in case something goes on with the cow. She goes down, you aren't able to get colostrum for the calf. Chains. If you know how to use a calf jack, having one of those can be helpful, especially with those backwards calves. And then your vet's phone number. If you have a vet on standby, knowing that. And having it handy it makes things a little bit less stressful if things are going awry, so you can get in contact with them as soon as possible.
And is there something we can inject the calf if they're not responding to perk them up, or other than the Medicam or?
Sure, yeah. So Medicam is the biggest one that I find getting them warmed up. You can use like calf perk. I don't say to keep that all the time. That's a caffeine supplement. Usually I say that for like our really cold calves that have been born for a while. Stimulation is big for those calves. And then yeah, just getting colostrum into them is key. But Medicam and colostrum are big ones for the calves that have had some difficulties. And then there's also something called the Magdalene squeeze. I haven't done it before. There is research out there, and it's to help those downer calves. It just squeezes their chest like they're coming back through the birth canal, and it helps to perk them up a little bit. Oh, and I see there's a question on the Q&A. The feel good grafting drug is called oxytocin. So it's naturally occurring in the body, and it's an injectable form, but you can squirt it up the nose, and it just seems to help graft calves onto cows a little bit easier.
Thanks.
Any other questions, Erin?
Yeah, one more question here. Is there anything you can give cows to help them dilate?
Not really. Stimulation is the big thing for dilation. So cows dilate because that calf's the feet and the nose push on the cervix. So getting your hands in there and pushing is the easiest way to help them dilate.
Okay, well, just to keep on time, we'll end the questions there. I really want to thank you, Shania, for your time. I know this is a busy time of year for you in terms of the calving season. So thanks again for taking the time out to share some of your thoughts and experiences with us. And we hope you have a great calving season ahead of you.
Thank you. Happy calving, everyone.
Okay, with that, I'll introduce our next speaker, who is Dr. Reynold Bergen, and he is the research or the science director at the BCRC, and he's going to be talking today to us about the Canadian Cow-Calf Survey and what the takeaways are from that survey, as well as the opportunities for Manitoba producers. So thanks for joining us, Reynold, and take it away.
Okay, you can see my screen.
Sure can.
Awesome. All right. Just to bring everybody up to speed on who we are. So when Dr. Jack was showing you some of the graphics from the Beef Research Council, that's us. So you are funding us. We're an industry organization. We're funded by your national checkoff that you pay. And so that's what's funding all the research we do. That's what's funding all the resources like the ones Dr. Jack was showing you. And our job is to support research and extension that'll help make our industry better. And all of the dollars that we're investing are producer dollars. And so all of the funding decisions that get made are made by producers like yourself. This is our current council. It's, people from all across the country, all different regions. And Manitoba's representatives are Melissa Atchison from Pipestone and Trevor Sund from Woodlands. And I'm going to talk today about the survey that we did back in the fall of 2023 and spring of 2024. The numbers are all crunched, so I'll tell you what we learned. So it was a survey of producers across the country about their management practices between when they bred cows in 2022 until when they weaned their calves in 2023. Focus on what the takeaways are for Manitoba and what some of the other resources that we've got that you help pay for that can help you take advantage of some of those opportunities. So first thing I'm going to talk about is the length of the breeding season. So Manitoba's got a longer breeding season than the national average. So cows in blue, heifers in orange, just around average, but a little bit longer. So longer breeding season, of course, means a longer calving season, means a less uniform calf crop. The less uniform calf crop generally means lower prices. It also means that if you're heifer calves that are born later in the calving season are going to have less time to develop before they're exposed to the bull if they're kept as a potential replacement. So, that's a potential opportunity to improve things a bit in Manitoba. Along the same lines, the ideal breeding season is 63 days or less in order to maintain a 365-day calving interval. And if that breeding season is longer than that, that means cows have an opportunity to calve later and later and later every year and then wean lighter and lighter and lighter calves. Manitoba's below the national average, so there are fewer producers in Manitoba with that optimal breeding season length. So there's considerable room to improve there. A longer breeding season, of course, means that your cows do have more opportunities to get bred. And a late calf is worth an awful lot more than a no calf at all. But that 63-day breeding season is quite achievable if nutrition's up to snuff, if cows are in good body condition score, bulls are fertile, there's enough of them, and that sort of thing, so they won't need those extra opportunities to get bred. Longer breeding season should allow more opportunities for cows to get bred. But Manitoba's actually got higher open rates than anywhere else in Canada for both the heifers and the cows. Most of the time, I suspect these open cows and heifers, it probably comes back to nutritional management and body condition score. Although bull power and disease, parasites can play a role there as well. Longer breeding season typically means a longer calving season, of course, for both cows and heifers, and certainly see that in Manitoba. So, knowing all of these places where Manitoba can improve in terms of a tighter breeding season, tighter calving season, better fertility, those are all intertwined things, and they're all typically related to nutrition. They're related to health. They're related to herd management, and just getting calves to living till weaning. So paying attention to the basics can help support your bottom line. And BCRC's got a lot of resources to demonstrate the benefits and the how-tos of good production practices. We do a bunch of webinars every year where we will pair a research expert, so in Manitoba, maybe somebody like Kim Ominski, together with a producer. So the idea there is that we'll have an expert talking about here's the science and here's why you should do something. And then the producer will be there talking about here's how I make this work on my operation. And then there's always a Q&A session where you can ask those individuals, okay, well, what about this? Um, Talk a little bit about health. Manitoba's right around the national average in terms of vaccinating the cow herd and the heifer herd. But there's, if the national average is 70% of cows getting vaccinated, that still means there's 30% of producers who aren't vaccinating their cows. When we ask, why don't you vaccinate their cows? The top two reasons are actually pretty troubling. The first one is, I've got a closed herd, so I don't need to vaccinate. That's probably not true. If you're leasing or buying or borrowing bulls, or if you ever buy heifers or cows, or if you use a community pasture, or if you share a fence line with a neighbor, or if you've got wildlife or stray dogs or anything, you do not have a closed herd. We got some infographics to demonstrate all of the different ways that pathogens can enter your operation. Second excuse to not vaccinate is, well, I'm happy with my conception rates, and I guess you might be, yeah, and you probably will be until something happens. And vaccination is really insurance. So not vaccinating is a lot like not buying insurance because your house is not currently on fire. Insurance is not going to prevent a fire, but what insurance will do is greatly reduce the amount of upheaval you're going to face if you do have a problem. Vaccines are the same. They're not going to prevent all disease, but they'll reduce the risk of it, and they'll reduce how bad it gets. And we've got links to all of these different vaccination resources. They're all free for you to use. You paid for them through your checkoff. We got blog posts, we got decision trees, we've got tips on how to handle and transport and store and mix and deliver vaccines. Take a bit of a jump to feed testing. Annual feed testing in Manitoba is right around the national average, but the national average is less than 50%. So there's room to improve everywhere. And of course, feed quality isn't consistent from year to year. It varies with growing conditions. It varies with weathering, how old the bales are. It varies with where it came from, if you're buying it, you name it. So last year's feed test is not going to tell you much about this year's feed. So listen to Pam when she tells you to test your feed. So we ask producers, why don't you test your feed? And the most common answer is, well, my cattle look healthy, which is a little bit dangerous because there have been cases of copper deficiency in cattle that were in great body condition, and the forage was green and lush. It looked great, and the well water was clear and abundant, and they ended up with devastatingly high open rates. So just the look of the feed can be misleading. Cost benefit can be a bit misleading too, because it may turn out that your feed is a lot higher quality than your cattle need. And so, maybe you're better off selling that feed to a dairy producer or a horse fanatic and buying less expensive stuff that's closer to what your cattle actually need, or to use your high quality feed for the heifers that are bred heifers that are still growing, or heifers you're still developing, or saving that stuff for later in pregnancy when the cows need the nutrients most, that kind of stuff. I don't know what to do with the results is fair enough comment. I mean, a feed analysis is only useful if you use it, and if it's just a sheet full of undecipherable hieroglyphics, it's not going to do you any good. But we've got a bunch of resources about how to make sense of all this stuff. Got a webinar that'll talk you through the ABCs of feed testing, why you should do it, how you should do it, and how to make sense of it. This is a tool we've got where you take your feed test, you plug in some of the key results from that feed test, you indicate what kind of cattle you're feeding, what kind of performance you're looking for, or what stage of production they're at, whether they're cows, in late gestation or early, and that kind of stuff. Size of the animals. Click this button and it'll give you a bunch of traffic lights: red, yellow, and green. Green meaning, yep, no, this nutrient's good. Yellow means, ooh, you might want to keep an eye on this one. And red might mean, like, this is really serious. You need to call Pam and get her to help you walk through how to go about fixing that particular issue. Mineral supplementation. So energy and protein, those are pretty important things, but so are minerals and vitamins. Manitoba's right around the national average, a little bit better in terms of providing mineral and vitamin supplements on a year-round basis. But of course, this still means there's probably, 15% of producers who aren't supplementing minerals and vitamins. Of those who do supplement, most of you are supplementing year round, some in winter, just strategically in winter, some just during calving, some during breeding season, some on pasture, some combination of all of them. Most of the time, minerals and vitamins are provided ad libitum, which just means free choice. And that's the easiest way to do it. It's easy to use a mineral block or a mineral feeder. The challenge with them always is that this animal might be consuming as much as, well, you're right, it's free choice, right? This animal may choose to eat more than it needs, and this one may choose to not eat any at all. And so it can be tough when it's free choice to make sure that everybody's getting what they need. Because mineral deficiencies and toxicities, they're both bad for health and fertility. So it's always a good idea to talk to your nutritionist about what minerals you need to think about in your area and how to make it work with your feeding program. Got lots of information on that stuff too. In some cases, chelated minerals might be the right choice, especially if you're in an area with low copper, which is a lot of Western Canada. Or if you're in an area with high molybdenum, which is also a lot of Western Canada. But chelated minerals can be expensive too. So talking to a nutritionist can actually save you money either by avoiding one of these nutritional problems or by avoiding paying too much for something that you might not need. Now, we've got a bunch of resources around trace minerals. One of the most recent things we've added to our repertoire is a podcast, because we've heard from some producers that BCRC puts out a lot of information, but I don't have time to read it because I'm too busy driving around and checking cows and stuff. And so what we've done is we started recording all of this material so you can listen to it while you're driving around and checking cows instead. We have recently started offering a ration balancing program called Cow Bites. Pam is very familiar with this one. A bunch of your nutritionists in Manitoba are going to be familiar with this one. This is the only thing that we charge producers for. We charge $60 a copy. And the reason for that is because it needs to be upgraded whenever nutritional requirements get upgraded. And also because currently it's on like a USB stick that we mail out. And so whenever it needs to be updated, we have to mail out a new copy and you have to install it and everything else. So our vision for this is that at some point, once we've sold enough copies and have enough revenue, we'll turn this into a web-based program so that it's a lot simpler to update, and then it would distribute automatically. Pre-weaning death loss. So getting cows to breed and calve is step one, but the calf also has to survive. So we ask producers about pre-weaning death loss. It's pretty consistent across Western Canada. Manitoba is right alongside with everybody else. And not surprisingly, death losses are higher in heifers than they are in cows. So about 6.5% for heifers, around 4%, 4.5% for cows. Remember those numbers for just a second. So total death loss was about 4.5% for cows, 6.5% for heifers. Death loss within the first 24 hours is right around 4%. So what that means is that if a calf is going to die, it's probably going to die within the first day of life. And Dr. Jack talked about a bunch of the stuff you can do to resuscitate those calves, make sure they get colostrum, keeping them alive, all the rest of it. These newborn calves are a pain to deal with, but when they're worth what they are, it's probably worth the effort to try to save them, even if you do decide to cull the mother and fall, or if you do decide not to keep that heifer calf as a replacement. And we've got a whole bunch of resources that can help you decide or identify calves that need help and then how to go about saving them. What do I have? Oh, I'm getting close to the end here. So implanting, we asked producers whether you implanted any of your 23 calves, and hardly anyone does. About 20% of producers across the country are just over 20% are implanting their calves. So that means at least 3/4 of producers across the country, 80% of producers in Manitoba are not using implants. So if that's you, you're missing a big opportunity. Implants are an opportunity that are very much worth considering. I could talk about this all day, but I won't. We asked, why don't you use implants? I'm not sure what happened to my animations here. The cost benefit concern around the cost benefit is really dubious. An implant costs about $2, but it's going to give you about 10 pounds of weaning weight extra, at least 10 pounds, probably a bunch more. And when each pound of weaning weight is worth $3 or $4, that's an easy 20-to-1 return on investment. It's easy to do. It's fast to do. Probably a higher than 20-to-1 return on investment, as a matter of fact. So they're a big opportunity. Now, we don't actually have a ton of information on our website about implants, so it's an information vacuum. And that's one of the reasons we did the survey, right? Is to find out, what are people doing, what aren't they doing, where do we need to put more information together? And so this is clearly one of the opportunities that's out there. So I'm going to stop here. Pam, if there's any questions, I'd be happy to entertain them. If you are subscribed to our website, that's great, because that means you find out before anybody else just what it is that we're doing with your checkoff dollars. But if you're not subscribed to our website, do click on this thing. It'll take you right take a picture of it. It'll take you right to our website, and it'll ask you, do you want to subscribe? Click yes, and then you will find out everything we're doing. You'll find out all this information we're putting out. I'm going to stop sharing now, Pam.
That's great, Reynold. Thank you so much. It's pretty much invaluable information with regards to what you guys do put out in terms of social media and the podcasts and your website. It's definitely very timely, and we appreciate all the work you do on behalf of the beef industry. Just a quick question for you. You talked about closed herds, or the analogy of a closed herd. I guess my question to you is there truly anybody who has a closed herd? Should that terminology even be used?
No. Seemed like a yes or no question.
Yeah, and I guess that's pretty much sort of the story that I want to, producers to process in their minds, is that it's really not an excuse that people should be using, correct? It's something that...
Yes, absolutely. Your herd is not closed. You might hope it is, or wish it was, or think it is, but it's not.
Yeah, so the importance of vaccinations and things like that are very, very important.
Yep. Got a question in the chat here. It's one that comes up every time I give this presentation, so you'd think that I should just work it in. Question is, should I use implants on calves that are intended for breeding purposes, heifers, bulls? So it's a 2 or 3-part answer. Never use it on bulls that are going to be kept for breeding. Just don't implant bulls. Heifers, you can implant heifers with a calf implant, but do not re-implant them at weaning. So a single implant, at spring processing should be okay, but don't re-implant them, because if you do, it'll impact fertility. What I would be inclined, if it was me, if it was my herd, I would definitely not implant any bulls I was keeping for breeding, but I probably wouldn't implant the heifers either if I was going to keep any replacements. If I knew they were all terminal cross heifers that were going to go to the auction mart, or if I knew for sure which ones I was going to keep for replacements, then maybe I'd just implant the rest of them. But I don't know. It's probably, if you're concerned about it, it's probably easiest to just implant the steers.
Are there any other questions, Erin?
Nothing in the Q&A.
It's
Sean?
Sean. It's Sean here. I have a couple comments and then I have a question. So one, so there was a question for Dr. Jack about how much oxy up the nostrils for the cows. And so we got the answer from her, and she said 2.5 mils up each nostril. So that's for the to help the cow adopt the calf if it's not accepting it. Um, and then comment on implants. MBFI did some work a couple of years ago, and they were finding it was the low 20s, 20 pounds that they were gaining extra weight on the calves that they implanted. And that was compared to calves not implanted, so within the same herd. So 20 pounds at that $3-4 is a really good return. My question was on covered tubs. So we like to promote the covered tubs to prevent the weathering of the mineral, just because once the mineral's weathered, the cattle don't like it, they don't need it, it gets wasted, and mineral's not cheap. So a producer mentioned to me that he was concerned with pink eye spreading with the use of covered tubs. Have you ever seen that, Reynold?
I haven't. I would defer if Dr. Jack's still on the horn, I would defer to her. Um, my understanding is that the spread of pink eye is generally associated a bit more with stemmy grass, that kind of stuff that's out there, and the flies, of course. But I haven't heard much about that with covered tubs.
She's not on, sorry.
Okay, I will find out. I'll ask around and I will let you know, Sean, and then you can spread the word.
Okay, thanks.
Another question in the Q&A, if heifers are implanted, does it affect long-term fertility?
It shouldn't. If they're implanted just at spring processing, when you would typically vaccinate them or brand them, so well before weaning, if you're implanting them then, it should not impact fertility at all. If you implant then and then implant them again at weaning, then you're asking for trouble. So don't do that. Just implant them once, at a month or two of age, and you should be fine.
Okay, with that, I want to thank you, Reynold, for taking the time out in your busy schedule to share information with us here back in Manitoba. So we appreciate that very, very much.
Always a pleasure.
All right. So,
Just seeing your desktop right now.
yeah.
You got lots of stuff on your desktop, Pam.
What's going on here?
If you just click the PowerPoint in the bottom, hopefully that'll bring it up. And then, yeah, your display settings again to swap.
It's very slow today.
Perfect.
All right. So I just wanted to again thank our speakers, and we do have one more of our seminars or webinar series coming up, and that will be on April the 10th, or is it April the 11th? The second Thursday, April 10th. And we'll be talking about range and pasture health. May Elsinger from Agriculture and Agri-Food Canada will be speaking, as well as Miranda Meehan from North Dakota State University, who will be talking about native pasture management. So please join us when we will be airing those at the same time. Just a reminder, we do have many information pamphlets and booklets, the calving books available at the MASC offices. So please stop by your local MASC office if you would like to get a copy of any of those. As a reminder, we do have a number of extension specialists across the province. Our livestock and forage ones are located in Dauphin, Arberg, Roblin, and Beausejour. And we also have the crop extension specialists located in Shoal Lake, Brandon, Swan River, Carmen, Gimli, and Steinbach. So with that, I also wanted to make note of the MASC centers. As you can see here, there's a list of them and the 1-800 phone numbers that you can contact, or you can also go to our website, which has all of the information as I noted earlier. And yeah, if you have any questions, please don't hesitate to reach out and contact one of us. So this concludes today's Stock Talk. Thank you for joining, and I hope you will join us the next time on April the 11th.